These are my three proposed problems. Number one, shortage of medical staff in public hospitals. One of the major problems in medical field today is the shortage of staff like nurses, doctors, pharmacists, and physical therapists. Number two, the lack of medical supplies in community health center. Major problem in community medical center is the shortage of medicine that affects the overall healthcare system of the community, especially in the rural areas in the Philippines. Number three is the untidy implementation of telemedicine. The telemedicine became the way to avoid the in-person contact checkup because of COVID-19, but its untidy implementation results into several problems such as data privacy and false diagnosis.
For my first problem is lack of water purification system in rural area. This study investigate the implementation of point of use of POU system in developing country focusing on household and communities. POU system are user friendly, low cost, and low maintenance. The grid independent reducing pathogens in water supplies and improving livelihood. The review evaluates technology implemented in this system over the past decades. For the second problem is sufficient wearable technology and patient health monitoring. This study explores wearable technology potential in healthcare, highlighting its potential for disease prevention, health maintenance, and patient management, but also highlighting challenges and opportunity. Wearable devices can impact clinical decision making and improve patient care quality while reducing costs. Minwoo 2021. Last but not the least is my third problem, absence of geothermal energy for production of renewable energy. Geothermal technology generated electricity and heat with low greenhouse gas emission utilizing renewable resources, advanced techniques store heat and scarce underground fluid using earth as energy battery. Success in this research will be able energy recovery and utilization.
Good day, everyone. My name is Lisandro Rulian, and here are my proposed problems. So, 1. Electrical hazards caused by tangled wires or cords. Whenever extension cords are utilized inappropriately, it can lead to fire or electric shock perils. The assessment of the awareness level of safety practices is yet to be rigorously pursued as an agenda towards extension cord usage in institutions and agencies perceived to be high energy consumers where fire outbreaks occur frequently. 2. Absence of earthquake alarms in Buting Senior High School. Earthquake early warning or EEW is relatively new strategy for reducing disaster risk and increasing resilience to seismic hazard in urban settings. But there are times that it can cause inadequate communications because during an earthquake, it is hard to have clear and effective communication channels and results in delayed response. 3. Equipment malfunctions in medical fields. Equipment malfunctions in hospitals are a significant problem due to various reasons. One of the factors contributing to these malfunctions is water damage. If water spills onto medical equipment, it can lead to malfunctioning, which can have potentially fatal consequences. This highlights the critical needs for hospitals to regularly maintain the medical equipment in use to prevent malfunctioning or failures.
This is my triple-pros problem, and the first problem is lack of psychosocial issues and sleep quality among seafarers. Seafarers work and live in a working place with specific requirements regarding safety and health. On long voyage tankers, working tasks are characterized by a wide range of activities such as watchkeeping, cargo load, and discharge under time pressure and frequently during the night, which are stressful by themselves. Seafarer is therefore associated with relevant mental health risks. And my second problem is lack of health monitoring system for maritime to detect handle any medical issues during journeys. Seafarers are exposed to a high diversity of occupational health hazards on board ship. Shipboard stress and high demand may lead to fatigue isolation, which have an impact on the health of onboard seafarers. Communicable disease and seafaring remain an occupational problem. Exposures to hazardous substances and UV light are important health risks on board ships. The last problem is safety benefits of implementing optimized scheduling system. To ensure safe, effective, and efficient marine operation, the optimization of maritime communication workflows with a task-oriented scheduling framework is of the utmost importance.
These are my three proposed problems. Number one, lack of workspace to create necessary plates or outputs. Some students lack the basic space needed for their studies. This creates a barrier for their progress as students, making it hard for them to finish their outputs and homeworks. Number two, high cost of materials in the market. Materials in the market for aspiring architecture students have never been cheap. Art materials are costly, and cheap alternatives have substandard quality. Number three, lack of portable workstations available in the market. The market has a substantial amount of work tables that are pricey and expensive. Cheap alternatives aren't that reliable either. Without having a middle ground for this, students are forced to choose between only the two options.
Today, we delve into three critical challenges facing maritime operations: outdated navigation system and detection of small boats or pirates, lack of solid waste management on board, and the availability of drinkable water. Let's explore these issues further. First is outdated navigation systems and detection of small boats or pirates. Relying on outdated navigation equipment on board ships make it extremely difficult to quickly identify tiny boats or pirate vessels. The security and safety of ships are at risk due to this technological shortcoming. In order to lessen this risk, research projects are being carried out to create modern systems that can identify this kind of hazards instantly, protecting crew members as well as ships. Second is lack of solid waste management on board. Untreated waste, including human waste and leftover food, finds its way into the maritime environment as a result of improper solid waste management on board, causing environmental harm. Research aimed to investigate sustainable waste management methods designed especially for maritime operations in order to prevent pollution and minimize the impact on marine ecosystems. This will help to promote environmental stewardship within the maritime industry. And the last one is undrinkable salt water. During long sailing journeys, seafarers' health depends on having access to clean drinking water. To guarantee that sailors will always have access to safe drinking water, this research project will look at modern technologies and purification methods. The aim of this research is to create an innovative water purification system tailored for rural areas, aiming to convert contaminated water sources into potable water, thereby improving access to clean drinking water in underserved communities. This involves developing a cost-effective and sustainable filter machine capable of removing a wide range of contaminants, conducting field trials to assess performance and usability, integrating stakeholders' feedback for refinement, and establishing sustainable maintenance mechanisms to ensure long-term functionality and scalability of the system.
The aim of the research is to provide the safe drinking water to all regardless of social economic background to improve public health and living standard. This also aimed at combat of waterborne diseases like diarrhea, chlorella, and typhoid. The research emphasized providing the safe drink water that is readily available and independent of unreliable sources like river, ponds, or well. This can empower communities, promote water conservation, and contribute to long-term sustainability.
For our second topic, innovating portable and space-saving table for students. This research aims to develop a table for students that consumes less space and is portable. With the help of this, students without proper space to study can create temporary workspaces for them to finish their homeworks or outputs.
Portable table also offer flexible learning spaces for students. It promotes collaboration and interaction among students, which can lead to enhanced learning through peer-to-peer interactions, discussions, and knowledge sharing. A study conducted by Virginia Commonwealth University showed that adaptable learning environments led to greater engagement and interaction among students.
Innovating automated earthquake alarms in the senior high school. This research aims to provide an automatic alarm for earthquakes. We already know that our school, Buting Senior High School, has no automatic alarm for earthquakes. Our alarms need to ring manually. In this study, we will innovate an earthquake alarm that will automatically turn on when it detects a shake in the facility. By having this automated alarm, we can lessen the casualties and damage from the earthquake. We can also lessen the risk of life of the person who will ring the old alarm system.
Innovating automated earthquake alarms in Buting Senior High School. Most earthquake damage occurs after arrival of the S wave, whose amplitude is about 5 times larger than the P wave. Because the P wave travels faster than the S wave, the interval between their arrival times creates an opportunity to activate an earthquake alarm and take preemptive safety measures. We develop an automatic system which transmits the earthquake shaking intensity before S wave arrival. The system can eliminate extraneous arrival time readings during the process of hypocenter location by checking automatically measure readings. P-wave not yet arrived data and their station distribution.